Welcome to the Rural Roots Canada podcast. I'm Tim Parent, joined as always by Mr. Craig Lester. And Craig, some breaking news this week that has gotten a lot of attention, and that's the federal government allowing the temporary use of strychnine in Alberta and Saskatchewan to help control that infestation of Richardson Ground Squirrels that both provinces have been appealing to Ottawa to help them out with.
Yeah, it was obviously some good news for farmers to get a little bit of reprieve there. Obviously, they're still getting everything up to speed in regards to getting everything in place to carry out this growing season sort of thing to help farmers out with protecting their crops. But this is a positive that they can take away in regards to that they've seen some movement from the PMRA and from the federal government and Health Canada in this regard, and it's going to definitely help some farmers out.
Yeah, so just to give you some background on this, Health Canada is authorizing a time-limited and controlled emergency use of the poison to help farmers deal with the millions of dollars in damage caused by the rodents. And we've covered this story for quite a while, Craig, and we even had Alberta's Minister of Agriculture and Irrigation, R.J. Sigurdsson, on talking about this on our podcast previously. But if you'll recall, earlier this year, the PMRA denied a joint request by Alberta and Saskatchewan to give emergency approval to use liquid strychnine to curb the spread of the Richardson's ground squirrel, or gophers, whichever you prefer to call them. Those things have damaged and destroyed crops and pastures. Last week, the two provinces, Alberta and Saskatchewan, submitted a revised joint emergency use request to Health Canada, and that was approved. So the updated submission included a reduced geographical scope, it revised product stewardship programs, and a revised product stewardship program, to reduce the potential environmental risks to an acceptable level. That was always one of the current concerns that were raised. R.J. Sigurdsson, as I mentioned, he's Alberta's Minister of Agriculture and Irrigation, put out a statement on this saying that the decision means that many prairie farmers will have another tool in their toolbox for gopher control, and adding that Alberta's producers have faced a lot of challenges managing Richardson's ground squirrels, and the loss of the use of strychnine was difficult and costly for many in the ag sector, and that was from Alberta's Minister of Ag and Irrigation, R.J. Sigurdsson. And Saskatchewan's Minister of Agriculture, David Merritt, agreed with saying that this was a huge win for the agriculture industry, and that Saskatchewan producers had been clear about the challenges they were facing in managing gophers with the limited tools that they had available to them. And Merritt is happy that the emergency use request was granted, and that this is going to protect crops and pastures from continued damage in that province as well.
Yeah, and as you may remember in that whole process that after it was denied, the premiers of Alberta and Saskatchewan, Daniel Smith and Scott Moe respectively, wrote to Prime Minister Mark Carney saying that they did not agree with this and that it needed to be revisited. And then it obviously came to fruition where we are now.
And that's good news for everybody for sure. I know that a lot of producers and farmers, from what we saw on the social media channels, on our channels as well, just a lot of relief in many respects, because as we all know, it's been doing a lot of damage. Some other news, and this one maybe flew under the radar, but maybe not. But if you're unaware, Alberta has a new Chief Provincial Veterinarian, and he's bringing a ground-level perspective shaped by his life on the farm and years in rural practice. New CBO is Dr. Hussein Kashwani, and I had a chance to sit down with Dr. Kashwani and talk about this new role that he finds himself in. I guess my first question to you is, Dr. Kashwani, is you grew up on a poultry farm near Rochester, Alberta. You were involved in 4-H. So how much did that farm upbringing shape the way you look at animal health today?
Yeah, I'd say growing up on a farm in Alberta, you certainly get an appreciation for the way that the business side of the industry has to link with the rest of it, right? Whether that's disease preparedness, disease response, and the practicality of animal health policy, really. Like, you need to have that on the ground perspective. You need to be able to gather those perspectives from producers and producer organizations to really understand the impact, so you can optimize those policies, so you can, control the risks and you control without having undue impact on producers.
Reading up on your bio and what the Alberta government had put out about yourself, and you spent some time in a rural mixed animal practice before moving into policy and public health. So what did those years in the field teach you about the realities that producers and I guess rural vets are facing as well?
Yeah, you're right. I spent a few years in Wetaskiwin at a mixed animal practice, and our caseload was about a 50-50 mix of large animal and companion animal. And those large animals were a lot of beef, dairy, equine, and a few other, camelids, things like that thrown in. And working in that rural practice, for me, was really valuable because my farm experience was not in the cattle industry. And so it really gave me a better grounding in the cattle industry, working with cow-calf producers, working with dairies, understanding sort of the day-to-day challenges they have, and also some of the challenges with timely access to care, right? If you have someone experiencing a respiratory outbreak in their cattle and you've got a full slate of appointments, it can be challenging to make sure you can provide them with the support they need, and also juggle all your other caseload. So certainly a valuable experience to understand sort of the producer perspective on things.
Right. You're stepping into the role after Dr. Keith Lehman held the job for a decade. What's the first thing you want Albertans, and I guess especially producers, to know about how you plan to approach the job?
Well, I certainly think I've got some big shoes to fill. Dr. Lehman, as you say, he'd been in the decade for a role, and he'd been in the role for a decade. I'll start that one again for you. So I certainly think I have some big shoes to fill. Dr. Lehman, who spent a decade in the role, was the longest serving Chief Provincial Veterinarian since the role was created back in the 90s, and is very well known and respected in the industries. So one of my first objectives is simply to get myself situated in the role. I have a lot of relationships with industry and with other partners, but just working to build and renew strong working relationships with producer organizations, commodity groups, our veterinary community, and provincial and federal partners in domestic and animal health, as well as public health. I think having those strong relationships is one of the most important pieces to ensure that we can effectively collaborate together and build strong animal and public health policy.
One thing we hear a lot about from the rural communities is the shortage of veterinarians in the rural areas. How serious is that problem in Alberta today?
You're right. It is a problem that we have a lack of veterinary professionals, and that's both veterinarians as well as veterinary technologists in the industry in general. That's both urban and rural. But certainly in rural, it's challenging because you've got producers need timely access, and at the same time, it can be challenging to run a rural practice, given the distances involved and maintain, clientele over large distances. I think, let me think on this one a little further for you.
Well, let me ask you this follow-up to that then. I guess it's kind of my question is, when a community doesn't have enough large animal vets nearby, what does that actually mean on the ground for producers and for their livestock, perhaps for people who are not familiar with the shortage situation? What does it mean on the ground for the producers?
When there is a shortage of food animal veterinarians out in our communities, particularly in rural Alberta, it can be very challenging for producers to access veterinary care in a timely manner. And that's particularly important when they're experiencing acute health issues. So for instance, an infection spreading within their herd. It can be, it's important that they get that timely care so they can get a diagnosis and they can get appropriate treatment initiated in their herd or their flock in a timely manner. And when they struggle to get that timely access, it can ultimately impact, the health of their herd or flock. It can impact the welfare of the animals, and ultimately it affects the bottom line of that producer if they lose animals that they might have otherwise been able to save.
And a reminder that this Rural Roots Canada podcast is brought to you by Kubota.
If you make hay, you know what's really in charge, the weather. So when you have a good window, it's go time, and you need equipment that helps you move fast, stay consistent, and avoid downtime. This episode is sponsored by Kubota Canada hay tools. From disc mowers and conditioners to tedders, rakes, mergers, round balers, wrappers, and more, it's a lineup built around the stuff that pays you back in season. That means clean cutting, terrain adaptability, and durability to go the distance. And because reliability isn't optional, Kubota backs it up with Canadian commitment. More than 50 years in Canada, plus a dealer network that's locally owned and ready to help when the season doesn't wait. That kind of dealer support means you're never far from people who understand the unique conditions your operation faces. And for extra peace of mind, all Kubota hay tools are backed by a 2-year factory warranty. Kubota Canada. Find the link in the show notes for more.
We know, and perhaps you can speak to this based on your own experience of living in rural communities and having been on a farm and worked in the rural with some of the mixed animal practices in the rural communities that you've been in. It can be pretty demanding. You're talking long hours. You mentioned it yourself, big distances, long distances between farms, and there's not perhaps as much supports as there could be. What do you think needs to change to make rural vet practices more attractive to perhaps students getting into the field, or just even into people who are perhaps considering moving to the rural areas?
In my understanding, the challenge of maintaining professionals within rural Alberta is really part of a bigger societal issue about making these communities attractive to professionals of all types, be that veterinarians, medical health professionals, and all other professions. And there has been a lot of work going into how do you make those communities attractive. And a big piece of it is ensuring that they are appealing to an individual who often is starting with a new young family. And how does that community provide for sort of their overall wellness, right? Jobs for their spouse, schools for their children, a welcoming community, things like that. And so I think that's a big part of it. That there is work still ongoing, and I'm part of a committee with the Alberta Veterinary Medical Association, looking at this issue with a fresh lens to see how can we support vets entering rural practice, and how can we support communities to make their centers attractive and appealing for young professionals to enter. The other thing I'll maybe mention is the government of Alberta has just launched a new funding stream under the Sustainable Canadian Agricultural Partnership that will provide some funding to help get students into rural practices for summer rotations. And the intent is that as they work in those communities over the summer and build relationships, they'll be more likely to forge bonds that cause them to come back to the community when they're fully qualified and support those communities and truly become a part of those communities.
Do you think that's a good step? Is that enough to help perhaps keep it shorter, or to attract people to the rural communities rather?
Well, I think the new funding program through SCAP, or Sustainable Canadian Agricultural Partnership, it's a step. It is a relatively small step in the scheme of things, right? We want to get students into those centers to get that experience. We also know that the veterinary school requires students to go through rural rotations to get a sense of what it's like in rural practice and try and sort of demystify it for those people who may not have been exposed to it in the past. But I think it's part of a larger strategy, right? These communities need to have long-term appeal. We need to get people having the confidence to work in these practices away from larger centers where they might have more ability to refer cases, things like that might feel more secure. Ultimately, if we can get them to build bonds in the communities, that seems to be what is most likely to keep them there long term.
Switching gears slightly and talking about Alberta producers having to deal with everything from avian influenza. I know we had a couple of cases in southern Alberta recently of PEDV. I guess from your perspective, what animal health issues are keeping you up right now? Anything you're keeping an eye on in particular? So
there's certainly those things that you could say are endemic to Canada, right? The things we most often are concerned with, like salmonella and PEDV. Some of the things that probably are the biggest fears for those of us in the animal health industries are foreign animal diseases, foot and mouth disease, African swine fever, which we have seen, particularly African swine fever. We've seen outbreaks in a lot of developed countries over the last few years, particularly in Europe, that really highlights the challenges with keeping these diseases out and with responding to them effectively if they show up. Right? With a disease like PEDV, it is a horrible disease for the affected producer, and we certainly need to respond quickly and make sure that it doesn't spread. But by and large, it does not lead to a closure of our international borders. Our livestock industries are heavily dependent on the export market, particularly when we're talking about pork and beef industries. And so a disease like ASF or FMD that would close our border for weeks or months or perhaps even longer, that's a huge concern because it can be really devastating for an industry. And so in terms of the bigger concerns, I think those are the ones that keep us up at night. I also think that as we work to prepare for those big diseases, FMD, ASF, that work really helps to contribute to our preparedness for other diseases also, right? The more we exercise and practice our traceability systems, our ability to respond quickly and stand up collaborative responses between industry and government, the better prepared we are for all types of diseases.
My last question, I guess you grew up wanting to be a vet. You never wavered from that goal, and now you're Alberta's chief provincial veterinarian. So I'm curious what your short-term goal is, perhaps, to something you want to accomplish in the next couple of years, and then even maybe a long-term goal that you're looking at.
Well, in the short term, I think just getting situated in the role and getting my feet under me and sort of taking the reins of the various committees and projects that Dr. Lehman has been involved with over the years and that I've been just starting to take over the last couple of years. I think that's sort of the short term for me. Overall, I think like this role is the chief veterinarian really plays a central role in protecting animal health, public health, and food safety across the province, and is key in the vitality of Alberta's livestock sector, the well-being of our communities, and the trust of Albertans in our food system. And so really my goal in this role is to support healthy, resilient, sustainable animal health systems, to protect animal health, support producers, ensure food safety, and maintain public trust.
And that was my interview with Dr. Hussein Kashwani. He is the new chief provincial veterinarian here in Alberta. And Craig, he really is bringing that ground level perspective because he did grow up on a farm, as you heard him mention, up near Rochester, which is just north of Edmonton.
Yeah, well, it was fantastic, interesting to hear that. And one of the things I really took away was to hear about his grassroots and his background growing up in the farm north of Edmonton, up there near Athabasca, and then also his rural practice in Wetaskiwin. So to hear all that background and where he comes from, and what has helped shaped his career and life was very fascinating.
Yeah, it was definitely, he was really forthcoming with his ideas and what he expects to do in this role, knowing he's got some big shoes to fill, as you heard him mention. And I'd like to thank Dr. Kashwani for joining me for that in-depth conversation. Thanks again to Kubota for sponsoring this episode. Choosing the right equipment for your hay operation is a big decision, so Kubota's dealer network is there to help you get it right. Whether you're looking at mowers, balers, or a complete hay tool setup, your local Kubota dealer can walk you through the options. Head to Kubota.ca and click Find a Dealer to connect with an expert near you. Thank you for joining us, and for Craig Lester, I'm Tim Parent. Thanks for listening to the Rural Roots Canada podcast.